I think that the position we're at the moment is a really good position, both in terms of how far we've come, but also compared to how others are doing nationally.
We started as a PPC consortium, and it has expanded under the new NHS reforms into the clinical commissioning group.
We've been together as a group now for around 5 years, and in that time we've really built some strong links with our GP practices. We're achieving some great financial performance in terms of underspend. We're doing really well, and with those savings that we're making, we're really starting to invest those back into patient care.
We've got a reputation, I think, as being very forward-thinking, very innovative, and a very pragmatic commissioning group, and I think that we've got a very similar mindset across all of our practices, and that's why we work so well together.
In addition to financial management, our clinical group has been the key driver in innovating a range of new services.
New ENT services, eye clinics, nerve conduction studies.
We've just employed a doctor for a few sessions so that we can deal with the end-of-life care and hospice care.
Things that we've had as aspirations for many years, but becoming a Pathfinder consortium has really given us kind of the impetus to be able to go ahead and do some of these things, such as how we're developing physiotherapy and podiatry services, for example. We're moving ahead in quite a different, innovative way by commissioning some services through an any qualified provider approach, which previously we haven't been able to do.
And we've been particularly impressed with the admissions prevention service.
We started initially as a pilot on the 1st of February 2011 with the remit really of trying to support patients to stay at home who had hit a crisis, whether it was social or a health crisis, and also to try and facilitate some discharges from Arrow Park Hospital. We've had about 175 patients through the service at the moment, and realistically then it's avoiding that hospital admission, so it's avoiding the risk of picking up hospital acquired infections, that it's a very patient-centred service, because the majority of frail elderly people, unless it's medically indicated, don't really warrant or benefit from being in hospital. The other group of patients that we have picked up on is patients where they've had failed or poor discharges from hospital, and care has broken down very quickly, and families that have agreed to something, or the patients agreed to something quite quickly, it's apparent that they're not coping, and I've been able to sort of deal with those patients as well to avoid them going back into hospital.
It's also brought unexpected benefits in that it's brought closer working with social services, and they've recognised that they've actually come out publicly in one of our executive meetings and highlighted that as an area of good practice, how we're both making a difference and working well together.
I think urgent care is quite a sexy topic from the point of view of the government, so there's an awful lot of projects that the government are pushing which may or may not fit with our agenda, but certainly on the Wirral we've had lots and lots of choice and perhaps a lack of cohesion, so the work that Sarah's doing and the work we're supporting and developing in is about bringing cohesion to the population of the Wirral, and from a CCG point of view, I think because we've been involved probably 12 months back at meetings with the acute trust, the ambulance service, liaison psychiatry, all sorts of other areas, that's helping drive things forward and hopefully breaking down some barriers.
We've got an urgent care network which brings together all of those different professional groups, and what's happened over the last 12 months is that the GPs have really taken the lead in that urgent care network. One of the unique things about this CCG is that it's looking to develop local services for urgent care and not just services within the acute trust. And we've commissioned minor injury services based in GP practices.
Qualified nurses on duty, providing a drop-in service for patients with minor injuries such as minor ailments like cuts, bruises, burns, basic problems like that maybe people would have gone to A&E with. It's extended itself now to providing a minor illness service as well, so we deal with chest infections, urinary tract infections, rashes in children, a whole host of medical problems now that again possibly people would have been going to Arrow Park, the local accident and emergency department for.
That's what's been wonderful about working in Wirral really, is that I feel that the nurses on Wirral are very dynamic, very forward thinking, very willing to take on new skills, go to new areas and extend and explore their roles.
The nurses have all done courses in minor injuries, minor illness. We're developing the role of the nurses so that they can all prescribe. We already have some nurse prescribers working in both the minor injuries units. This is also taking the burden off the local GPs as well, knowing that they can advertise this as a service to their patients.
A multidisciplinary approach gives the best for the patient because everyone's working within their fields of expertise and therefore patients or people are being properly assessed. You know, we're having discussion fora within multidisciplinary teams, and that way the patient is getting what the patient needs and the family around them and their support network is having the care brought to the place where it's required.
It's that coming together of everybody from all professions really, and I think the opportunity to see what other health care professionals can offer, not necessarily just nurses, but physiotherapists, occupational therapists, everybody really in the wider sense of a healthcare team.
I think our group certainly is significantly more developed than other areas in the country in having the level of clinical engagement, and certainly one thing that's obviously vital if you're looking at service redesign is having patient engagement, and our patient council is obviously vital if we're going to redesign, because redesign may mean commissioning things differently and it may actually mean decommissioning services, and if our patient council isn't fully on board in that process, we simply won't be able to change services and we won't be able to make them more cohesive.
To some extent, before we sort of felt out of it. Now here we know from the highest point in government, should we say, that this is going to be something, this whole business is going to be something which is GP-led. Now, of course, previously it wasn't, and personally I think that a GP-led NHS clearly has got to be a better option.
They're a really, really good bunch with very sensible ideas, but they don't just pay lip service, they come with very, very honest ideas.
When I first joined, I thought the doctors might be a little bit thinking, well, these interfering old so-and-sos. But no, they haven't. They've been very cooperative.
And that's what we need. We don't just want patient engagement to be tokenistic. We want it to be very, very real and very meaningful, and we want our patients to feel like they are part of us as an organisation.
We do have an input, and they do listen, and they do take action. You can't ask for more than that as a patient.
I think as well what's come across from some of the patient meetings is that they really, really do understand the pressures in the NHS and some of the financial difficulties and want to work with us to make sure that we're investing in the right areas, and some of those difficult decisions where we might need to disinvest from services to reinvest them into new and better services. So when we've talked on things like medicines waste and some of the current services that we run, they've understood that they have to change.
I've actually talked to our patient council quite extensively about changing the way the ambulance service works on the Wirral. We've also talked to them about the implementation of the new urgent care phone number 111. So we've collected a lot of their support and their views on some of those developments, and actually helping us design the services going forward.
At the end of it, they really want to see a better deal for patients, and they're happy to take those back to their communities as well and help to reinforce those messages. A lot of the patients that come to our group have links into local communities and to voluntary service and those sort of things. So there's a real network of things that we can tap into out there.
We are doing everything that is part of the NHS reforms. We're improving access, we're improving choice, we're engaging patients, we're engaging our clinicians. In addition to that, we are working with the other two consortiums in Wirral on Wirral-wide issues. So we've got the benefit of working for the benefit of all groups, the practices in our patients in our consortium area, but we are also working with the other consortiums for the benefit of people right across Wirral, with all the hospitals and other providers.
There's still quite a lot of work to do, but I think what the GPs are bringing to the table is some real clinical leadership and a vision for the people of Wirral as well, and driving it forward and actually making it happen. Not just having a plan, but actually going out and doing it as well.
So that is exciting and changing times. We are now doing much more than what we used to do 5-6 years ago.
we are delighted to have been shortlisted for this award. But the key thing really is that it is a recognition to us that people have looked into what we've done. We've achieved the status as a pathfinder, and this comes on top of that. This gives a great encouragement for us to go forward with the NHS reforms and the new agenda. We want to strengthen our patient engagement, we want to strengthen our clinical engagement, and with robust governance and management, we believe that we can deliver a high quality service for our population, which is based on financial good value for money, but it also good clinical outcomes.
Anything else you want to say?
No, I hope it's good. I hope we win.